housekeeping items. The webinar will be recorded and posted on our website. The slide deck will be posted soon. The chat option is disabled, yet there will be multiple times throughout this webinar for question and answer sessions. I'm going to allow another minute or two for folks to join, and then I'm going to introduce our first speaker. Thank you. All right, thank you, everyone. I am excited to introduce our first presenter, Karen Rizal, Deputy Director of Healthcare Workforce Development. Thank you, Karen.
Thank you, Michelle. Good afternoon. Thank you for joining us during your lunchtime. We appreciate everyone attending today. As Michelle mentioned, I'm Karen Rizal here at HCI as the Deputy Director over Healthcare Workforce Development. I wanted to just walk you through quickly the agenda for today. At this meeting, we plan to talk you through and walk through our program, what we're trying to accomplish, how you can apply, and be available to you to answer any questions. Next slide, please. So just for those of you that no, we still have a new name, the Department of Healthcare Access and Information. It's been getting close to a year now, but for many years we're Office of Statewide Health Planning and Development, and with last year's budget, we became the Department of Healthcare Access and Information. And just wanted to really reinforce that even though the name has changed, what we do remains. We're firmly committed to the work that we do, which is ensuring that every California has access to equitable, affordable, quality health care provided in a safe environment by a diverse workforce. And so we really think that our programs here today, what we're going to be talking about with the program we're introducing, is really around how can we create and build that diverse workforce that serves Californians. Next slide, please. This particular program that we're talking about today, our Psychiatric Education Capacity Expansion, or PECE, long name for a program that supports, this particular program supports psychiatric mental health nurse practitioners. This program began in 2019, and this is actually our second application cycle for this program. The goal really is to support the building the diverse workforce that we need. We all know that the need for behavioral health workforce is great, and that we need to build psychiatrists, psychiatric public health mental nurse practitioners, that social workers, all kinds of behavioral health workforce. The need is great. And so this program is really how do we expand the capacity to be able to train the needed workforce? And how do we, and to do that, how are we increasing the number of underrepresented individuals who are receiving that training and practicing? How are we ensuring that we have a workforce that is distributed across California, serving in the areas that we need? We know that there are underserved areas, and so we want to be able to train and have a workforce that is fanning out and working in those areas of need. But also, how do we support building the capacity to be more culturally and linguistically diverse? That again, this is we have a diverse California, and so we want to build a workforce that serves that diverse California. And so this particular program, I will turn it over to Ian Powell, our health program specialist, who will really talk through this program. But it's really about how do we build the capacity to build and expand the number of psychiatric mental health nurse practitioners that we're training in California. Thank you.
Thank you, Karen. As Karen noted, the purpose of the PECE grant program is to increase the supply of both psychiatrists and of psychiatric mental health nurse practitioners. Next slide. There are 9 guiding principles. They're quite detailed. I won't go into them, except to say that the emphasis is on being client-centered and with a priority on early intervention, that we ensure racial diversity, cultural humility, and linguistically competent workforce. That's an important principle. And that we outreach and engage with those who have not been served, who are underserved, and or who were inappropriately served. Next slide. At the heart of it, of our guiding principles also is wellness, recovery, and resilience, and other positive behavioral health strategies. That we reflect in the work, the viewpoints and expertise of persons with lived experience, that we work collaboratively with the individualized strength-based to deliver individualized strength-based consumer and family-driven care, and that we have an interprofessional strategy where we work across disciplines. And that all of these principles inform the educational materials and training that grantees deliver. Next slide. So funding, there are 2 points to be made here. As I've mentioned earlier, the program is for psychiatry residency and for psych mental health nurse practitioner training programs. The allocation of the funds available will to each of the disciplines will depend on the applications evaluation scores and the geographic and achieving geographic coverage across California. Next slide. So for new programs, the money is intended to enable the grantee to secure national accreditation and State Board of Registered Nurses, BRN, approval of the program. For expansion, the funds are intended to support the operational costs associated with actual training of additional students. Next slide. New program grants are for 3 years. We expect that national accreditation and BRN approval will be secured by June 30, 2025. Funds will be released in 2 payments. The first is 25% when the grant is executed. The remainder of funds will be available for new programs when we receive proof of the work has been complete and that national accreditation and state BRN approval has been secured. Additionally, there will be a final report that needs to be submitted. Next slide. For program expansion, the grants are for 5 years. And in this case, the first year is intended to be for development of the expansion, for hiring faculty, field supervisors, and recruiting students. And that during that first year that you seek out any necessary accreditation or BRN approval. We recognize some programs already have that, some may not. Next slide, thank you. So there are 3 considerations for awards. One is that these funds cannot be used to supplant additional or funding that was received by the grantee from another source for the same purpose. That there are no admin or indirect costs permitted because that's built into the capitation rate. And that award levels may be made in full or partial or none based on the applicant's score of their evaluation score and the amount of funds available. Next slide. Michelle?
Thank you, Anne. So for this period of question and answers, if you have a question, please raise the hand icon. As a gentle reminder, the chat option is disabled. Once you raise the hand icon, which you will find in the reactions button, you'll be placed in a queue. I will call on you by your first and last name. Your mic will be enabled and you will need to unmute yourself. To unmute yourself, the mic button is at the top of the screen. After you're done speaking, please mute yourself. If we are unable to get to your question or all your questions, please feel free to email the address on the question slide and we will respond after the webinar. Thank you. I see Beth Phoenix, please, if you want to unmute yourself.
Hi, and thank you for having this webinar. This is really great to have this opportunity to ask questions. So I have a couple of questions. One is, can a single institution that has two different levels of program, say a postmaster certificate program and a master's or DNP program, could the application include both of those programs? And then I have another more detailed question about the primary rotation sites.
Great. Thanks, Beth. So as we understand it now, there are three levels of potential expansion. One is 1 year psych nurse practitioners, another is 2 year psych nurse practitioners, and the third, which you noted for us this morning, was DPNs, or DNPs, excuse me. So doctorates of nurse practitioner. So assuming that that doctorate of nurse practitioner is specializing in psychiatric mental health, we would ask you to fill out the application for 2 years and then email us that you have submitted an application, and we'll send you a budget to adjust for the third year.
So my question is, could you apply for more than one of those levels of programs in the same application?
In an application for expansion, yes, you can.
Okay.
Yeah. If you're
Great.
applying for a new program, it would have to be separate from an expansion application.
Excellent. Okay. And then I also have a question about there's a separate workbook for that will require information about rotation sites for students. The link to that in the PDF of what information we have to submit doesn't work. So I'm asking this question because as a large program, we have, in any given year, we probably are using over 100 placement sites, which obviously it would be quite a significant work effort to submit information about payer mix and language and patient characteristics on all of those rotation sites. So I'm wondering if you have any guidance about, can we kind of, take the top 10, where students have completed the most hours, or, how do we kind of make a good faith effort to provide information that's representative of our clinical sites without having to do every single one.
Right. Thank you for that question. So we're interested in your primary rotation sites. So we can't say to you if it's the top 10 or not. That's your call. And if you'd like to discuss this further, send us an email and we can discuss it offline.
Great, thank you.
Let me also take this moment to mention that there's been some concern about how do we get the threshold language information. Every health site that takes Medi-Cal will have that information. So you can ask the site to give you that data.
Great, thank you.
Thank you, Anne and Beth. Next is Karen McCauley, please unmute yourself.
Yes, I'm Karen McCauley from San Diego State University, and looking at the possibility of opening a new program. And my question is two things. Now that NOF has moved the clinical hours requirement for nurse practitioners from 500 to 750 hours for each of the specialties, and also the move towards launching DNP programs versus MSN programs. And when I'm looking through the application, it looks as though you're looking for 1 year postmaster's certificate students or 2-year MSN students. What are your thoughts on moving for new programs of launching DNP programs versus MSN as nurse practitioner education is moving to?
As I noted earlier in Beth's question, this would be a situation where you would be applying if they are a specialty in psychiatric mental health. Even for a DPN, they'd need to have that specialty. And for that class, we'll make available a budget sheet for the 3rd year. We'll have to talk more offline regarding the increase from 500 hours to 700 hours. We were not aware of that. That's a recent change since our last launch.
Okay, yeah, that was just recently launched by the task force, nurse practitioner task force.
Yeah, so we'll have to work together on that.
Okay, thank you.
Thank you, Karen. Anyone else? If you have a question, raise your hand icon and the reactions button up on top, please. All right, we can move on to the next section then.
Thank you for your questions, and I will now turn it over to my colleague, John Madrid.
Thank you, Anne. Good afternoon, everyone. During this part of the webinar, we're going to be discussing the grant application basics. In the webinar slide deck, we do have a direct link to the online application to apply for both the PECE Psych Residency and the PECE Psychiatric Mental Health Nurse Practitioner Training Program. It's the same link for both, but you'll have an opportunity to select Psych Nurse Training Program. We also have a PDF version on our website, so you can review the questions before filling out the application online. And then we strongly encourage you to visit our website and review the grant guide in its entirety before applying online. Most of your questions will be answered by reviewing the grant guide, so we strongly encourage that you do that. Next slide, please. In the application itself, you'll be asked to list current and/or proposed field placement sites. You'll also be asked to upload or submit a letter of sustainability committing the sponsoring organization to support new or additional training slots when the HCI grant ends. We want to ensure that after the funding period has ended, that the expansion or the creation of new programs will continue on beyond the funding date of the grant. Next slide, please. When you complete the budget on the application for new for new psych nurse training programs, eligible programs may receive an award up to $1 million. For expansion of existing psych nurse training programs, eligible organizations may receive up to $75,000 per filled first-year positions. Next slide, please. Okay, at this point, I'd like to entertain any questions.
Thank you, John. And I see that Beth Phoenix has a question. Your mics will be enabled, and if you can just unmute yourself, please, Beth.
Great, thank you. Yeah, me again. So just in terms of the filling out the budget information, I'm a little unclear about the funding for the planning year. Would we be applying, say if we're if we're planning to increase our cohort by 5 students or whatever, would we budget based on, 5 times 75,000 that we are planning to increase our cohort by the following year? I guess that whole planning year is a little unclear to me.
The planning year is just so that you can identify that you're not going to be required to place any new students during that first year. That first year is so that we can award the grant, and with it being executed within the first fiscal year of 22-23. And then if you have a budget for that planning year, you can include that in the budget. The cap of 75,000 per filled new position, first year position, it helps establish the maximum budget grant award amount based on the number of new first year students. So it helps establish the cap. It's to capitalize the grant itself, and it helps to establish the total amount of funding that you can ask for. But in the budget, you can break it down per year, but as long as it doesn't go above the total maximum amount of 75,000 per first year psych nurse student.
And is that new first year students per year?
If you're adding new students in, say, year 2 and adding new students in year 3, first year students, then it would be for those years that you're adding first year students.
Okay, so I just want to make sure I understand this. So say in year 2, we add an additional 5 first year students. So then for year 3, do we, if we say then, what's the baseline? Is the baseline the number of students during the planning year, or do we have to keep increasing it by 5 every year?
You would need to increase it if you want additional funding cap. For example, if you're adding 5 first year students in year 2 and 5 first year students in year 3, that's a total of 10 first year students that you're going to be adding, so you can multiply the 75,000 by 10. If you're only going to be adding 5 new students during the entirety of the grant period, then that would be 75,000 times 5 for the grant in order to establish the maximum grant award under the
John,
grant.
could I clarify here?
Yes, please.
It's 75,000 per year per student, and the count is based on each first year the student is admitted. So if you have a 2-year program, you could get up to 150,000 for that 2-year period for that student. If you have a 1-year program, it's 75,000 for 1 year. Does that make sense? Does that clarify?
Yeah, I think so.
Oh, thank you, Anne. Thank you for clarifying that. 1 year versus 2-year students.
Thank you, Beth. And feel free to email as more questions come up after this webinar. Feel free to email. We will be responsive to any of your questions. Any other raised hands? All right. Steve Coe, please unmute yourself.
Yeah, hi, I'm Steve Coe from San Diego. So sort of piggyback on that previous question, but about a new program. So the $1 million for what essentially would be kind of like a startup sort of cost, is the same $75K per position per year. Is that still applicable within that $1 million?
No, that only applies. The 75,000 per first year student is for expansion of existing programs. The $1 million cap is for new programs.
Okay, so then within that new program, that the $1 million, so there's no, so putting together the budget, so the expectation isn't to then assign the student tuition support or anything that has to do with the new student within the new programs start, correct? Like it's just basically all to be used for startup, essentially.
That's correct.
Okay, and then, okay, and then just quick follow up to the previous. So if you have multi-year sort of track, the expectation then is to come up with the initial number of these students. Let's say I'm making it up, but let's say it's 5 students for year 1, and as they matriculate to year 2, those folks will be now second year, but then you would bring on 5 new folks during year 1. So overall then across those 2 years, you're looking at 15 folks that you're funding. That's how we should be thinking about this, right?
Well, that's up to your program to decide. You can tell us that you intend to add new students every year over a 3-year period, but that's basically for the expansion of existing programs. For new programs, you just tell us how many students overall you intend to include in the new program, and then the reimbursement is based on the total costs of starting a new psych nurse program and achieving all the national accreditation and statewide and state approval.
Got it. Thank you very much.
You're welcome.
Thank you. Next question, Montel Rudolph. Please unmute yourself.
Sure. Good afternoon. My name is Montel Rudolph. I'm on the line today from Charles R. Drew University of Medicine and Science in Los Angeles. And I was wondering about the cap for these continuing or expansion programs. Is it $250, the cap per year for this cap? Is there a cap? I know it's 75 per student. Is there a cap?
Right. There's no cap. There's no cap for the number of new first-year students you intend to place.
Okay, great. Thank you.
You're welcome.
John, if I could add that when people figure out how many years or how many cycles to keep in mind that the grant ends in 26-7. So that would be the last year of the student attending on expansion programs. So you need to calculate when the students would begin in order for the last cohort to end at that grant, when the grant ends.
Okay, thank you, Anne. Let's go ahead and move on to our next section, please.
Okay, I'm going to move this on to Kevin McAvelli. He's our research data specialist over at Healthcare Workforce.
Thanks, John. So our scoring criteria for this application was developed to align with the PECE guiding principles. The application will ask about some program strategies and more detailed information on the rotation sites. Some questions about the rotation sites in that facilities workbook that was brought up earlier include patients served who speak primarily Medi-Cal threshold languages. That's broken out by language. The HPSA mental health score based on the location of rotation sites, a proportion of children and adolescents served, that's 0 to 18, 18 to 25-year-olds, percent of rotation months in rural areas, and then the more general program goals are cultural and responsive care training in the program's curriculum. Also in the facilities workbook is the payer mix, Medi-Cal, Medicare, uninsured, and an additional goal of the program is to support geographic distribution across California. Next slide, please. There will be annual reports required for program participants. The annual report will be opened on July 1st of each grant year, and the report will be due at the end of the month on the 31st. Elements of this report include information about the numbers of applicants and admitted students, and those interested in serving underserved communities, as well as the use of PECE values and principles in training methods. And then we'll move to the next slide and open it back up for questions.
All right, thank you, Kevin. Go ahead and raise the hand icon and I will call on you as you appear in the queue. Thank you. We have Karen McCauley. Please unmute yourself.
Yes, again, Karen McCauley from San Diego State University. The other thing that I just wanted to get clarified for new programs, is I understand that 25% of the funding would be available on enrollment. However, the rest of it would not be available once you received CCNE and BRN accreditation. So for CCNE accreditation, that is required 90 days prior or after enrolling students. So I understand that we probably wouldn't, for new programs, be enrolling students until the last year. Was that the implication?
This is Ann Powell. Yes, that is. What we know also is that some sites already have accreditation and approval for expansion. It would be for new, there would not be any enrollment involved.
So the enrollment would be in the last year or not involved at all?
For new programs, there's no enrollment. It's everything that you need to do to stand up your program before you actually recruit.
I see. And so once you got that program, CCNE and BRN approved, after you've gone through the curriculum and finding the clinical sites, the faculty and so forth, then you would start to enroll students after the deadline, right?
So for a new program, there would never be enrollment.
Okay.
You would be seeking a new funding stream for your resident or for your nurse practitioner students.
Makes sense. Thank you for that clarification.
Thank you. And just providing a gentle reminder that we will be posting this webinar recording as well as the slide deck on our website. Thanks. Next question is from Beth Phoenix, please.
Hi. So it does make reference in the RFP, you know, that it's important to include information about your curriculum and your training in terms of including, you know, that it's culturally competent and patient-centered and all that. But there's no place that I see on the application where that information is requested. So I'm wondering how we would submit that information, and also if there's, you know, there's certain things that we have to submit, such as accreditation, but there's no kind of executive summary or anything that talks about, that kind of provides an overview of the program that I can see. I mean, I think, actually there is at the beginning. But yeah, I guess that's my question, is how will we include information about our curriculum?
Go ahead, Ed. I think the best place for it would be the question in the first block. Please provide an executive summary for your program.
Yes.
Thank you. Angela Hudson.
Thank you. Angela Hudson, Samuel Merritt University. We are starting a new Psych MP DMP program this fall of 2022. And we will enroll. We've already started recruiting because we have lost recruitment. We are still awaiting CCNE approval. And that is within 90 days of the start of the program, as one commenter mentioned. So am I applying then, would I apply for a new program or an expansion of the program that's starting this fall?
If you're at the point in your process where you're, I'm getting feedback, so forgive my, if you were at the point where you're recruiting students, you would be applying for an expansion.
Thank you.
Thank you. Any other questions, please? Raise your hand. Delia Santana. Please unmute yourself.
Hi, this is Delia Santana from Charles R. Drew University of Medicine and Science in Los Angeles. I was wondering about the payer mix. How do you provide the documentation for the payer mix? What are you looking for in that to be able to justify the points?
In the facilities workbook, there's a page called Payer Mix, which by site we ask to please provide the percentage of Medicare, Medi-Cal dually eligible, Medi-Cal uninsured, and other for by site.
And to expand on Kevin's description, you would get that from your site.
Okay, thank you.
Thank you. Beth?
Yeah, so my question, just to follow up on that, is it possible to make available to us a kind of a similar thing, a PDF that sort of includes all the information that's requested in the facilities workbook?
Yes, we will make that available.
Okay. Thank you. Any other questions, please?
All right, if that's it, I will pass the mic back to Anne for closing comments. Thanks, everybody.
Thank you. Next slide, please. Thanks. So Karen had to leave early, so I'm going to serve as in providing closing information. So by way of reference information, the application period opened on May 27, and it closes at 3 o'clock on July 1. For information about all of our behavioral health programs, be sure to check out this website on our HCI webpage. And then for overall information, we encourage people to look at our funding eligibility tool, because you may find that there are resources that you might want to tap into for your students or your program. For example, scholarships. Next slide. Before I close, we have one more question.
Yes, and I apologize if I mispronounce your name. Delia Santana, please.
Delia.
Hi, thank you. It's Delia. Thank you so much. Again, from Charles Drew University. I am looking at the points for children and youth makeup of 25% of more. Are we looking at total patient population for a specific time frame? So is it per semester that our patients are seen by our students, or is it per, what's the time frame you're referring to?
So what we intend for you to give to us is information at the time you apply. What is the age makeup of the clients or patients served at the rotation, your primary rotation sites?
Perfect. Thank you.
Thank you. Angela Hudson?
Thank you. I've looked at the guidance, but haven't been able to find the facilities workbook. Where may I see that again?
We will update either the preview PDF of the survey to make a functional link in there for the facilities workbook, or we'll just add the facilities workbook directly to the webpage. We'll have to get back to you about that, but we will make it available.
Thank you.
Thank you.
All right. So in closing, we want to thank all of you for participating. We're very excited for your interest in this program. We are really happy to be able to offer this new grant opportunity. And we suggest that you keep up to date by joining our mailing list at the website URL posted on this slide. And then any questions you have that we have not addressed or that occur to you later, email our MHSA wet at hchi.ca.gov email account, and we will get back to you at earliest opportunity. And with that, we thank you for joining and wish you a good day.
Thanks, everyone.